Receiving and storage. Follow recommendations from Health Canada and your Ministry of Health on how to store the Pfizer BioNTech COVID-19 vaccine for pediatrics. The vaccine can be stored in the refrigerator for up to 10 weeks after thawing. You must dilute the vaccine within 12 hours after removal from refrigeration. You will need to administer the vaccine within 12 hours after dilution. Supplies and workstation setup. Check your list of supplies. You will need a sharps container, alcohol wipes, gloves, hand sanitizer, and sodium chloride 0.9% preservative-free vials. You'll also need 1 ml and 3 ml syringes and 21 to 25 gauge 5/8 to 1 inch needles. Include a small bin for garbage, empty bins, and a surface cleaner that contains disinfectant and general virucide. Extra supplies can include a task light, chemo mat, and a gown. Now, find an area away from traffic to designate as your workstation, ideally with a table or desk that can be sanitized. Wipe down the surface of the workstation with your disinfectant or virucide cleaner. If you have a chemo preparation mat, place it on the surface. Arrange supplies on the borders of your work surface in an organized fashion and within easy reach. Place sharps container on the work surface or floor beside you. Choosing and preparing syringes. A variety of needles and syringes are appropriate for diluting and preparing the vaccine. We have found the following products work well. To dilute the vaccine, use a 3 ml syringe and a 21 to 25 gauge needle to draw up 1.3 ml of normal saline. To draw up the vaccine, we recommend a low, dead volume 1 ml syringe and a 25 gauge needle with a length of 5/8 to 1 inches. A low dead volume 1 ml syringe will help you maximize the number of doses from each vial. If standard syringes and needles are used, you may not be able to extract 10 doses from a single vial. For each vial of vaccine, prepare 1 3 ml syringe for saline and 10 1 ml syringes for vaccine doses. We recommend wearing gloves when you prepare the needles, dilute the vaccine, and prepare the individual doses. Preparing the normal saline. To prepare the normal saline, use the prepared 3 ml syringe. Swab the top of the normal saline with a clean alcohol swab. Let it dry. You can place the alcohol swab in the work area with the cap of the needle on it to keep it clean. To minimize the number of bubbles in the saline, draw up 1.3 ml of air in the syringe. Inject the air into the saline vial. Note that a few champagne-sized bubbles are okay. Ensure the bubbles do not affect the final volume of normal saline diluent. Diluting and mixing the vaccine. Check your vial. The pediatric formulation has an orange plastic cap and an orange label border. Note that this formulation must be used for individuals 5 to 11 years old. Take the vaccine out of refrigeration. You can dilute it once it comes to room temperature. Invert the vaccine vial gently 10 times. Inspect the vial. The liquid should be an off-white solution. Do not use if the liquid is discolored. Remove the cap and swab the top of the vaccine vial with a new alcohol swab. Slowly inject the 1.3 ml of normal saline diluent into the vaccine, allowing the plunger on the needle to come back and equalize the pressure in the vaccine vial. Withdraw about 1.3 ml of air to equalize the pressure in the vaccine vial. Once again, gently invert the diluted vaccine vial 10 times. The vaccine will be a white to off-white suspension. Drawing up the doses. The vaccine is now ready to be drawn for administration. We recommend you withdraw all 10 doses at one time. Swab the vaccine vial with a new alcohol swab. Place the swab on your workstation. Draw up 0.2 ml of air into a 1 ml syringe. Remove the needle cap and place it on the alcohol swab to keep it clean. Inject the air into the vaccine vial and slowly draw up 0.2 ml of vaccine. Turn the vial so you can see in between the edges of the label to where the needle is in the vial. This will help prevent drawing air into the syringe. Note: you never want the hub of your syringe to touch the top of the vial. Draw up the vaccine slowly to help prevent bubbles in the syringe. If there are bubbles, inject the vaccine slowly back into the vial and pull up the dose again. A few small champagne bubbles are okay. Never tap or flick the syringe when there is vaccine in it, as this could inactivate the vaccine. Note that if a syringe is prepared with vaccine is dropped, it should be discarded and not administered. You have the correct dose when the top of the plunger stopper is lined up with the 0.2 ml line on the syringe. Remember, when you are drawing up the vaccine doses, you want to make a new puncture hole each time. A good tip is to start at the same spot each time. For example, the spot that is right above the lot number and manufacture date on the label. Then, rotate the vial either clockwise or counterclockwise for each new vaccine dose draw. Now you can prepare the next dose. With a new alcohol pad, swab the vial, inject 0.2 ml of air, and draw out 0.2 ml of vaccine. Repeat these steps for a total of 10 doses. Use a new alcohol pad every time a dose is drawn. Note there is no recommendation to replace the needle on the 1 ml prepared syringes before administration. Document according to your site's practices. Your label should include pediatric to distinguish the dose. Note that vial labels and cartons may state that a vial should be used within 6 hours. However, the product monograph from November 2021 overrides this information. Your doses are now ready for administration. They must be used within 12 hours of dilution.